Hey everyone, welcome to GrowMed. In this video, we will look at the certain one-line questions, important one-line questions which are asked in the Fmge from the pathology. So before starting, if you're new to my channel, subscribe to GrowMed and tap the bell icon to get notification whenever I post the video. So let's start. The first question, most abundant plasma protein, and the answer is the albumin. So albumin is the most abundant plasma protein. Then the next question, type of necrosis seen in the brain. It is the liquefactive necrosis. So the other name for the liquefactive necrosis, it is also called as collicative. So this is the most characteristic feature that this type of necrosis is seen only in the brain. And necrosis topic, a very important topic. There are various kind of necrosis, coagulative necrosis, fatty necrosis. So you need to know all the points related to them and in which organs they are seen. So moving to the next, the necrosis seen in the TB, and it is the caseous necrosis which we can see in the TB. So the important finding of this caseous necrosis is there will be cheesy material present. Then the next question, marker of the apoptosis, and the answer is the CD95. So it is the marker of the apoptosis. Characteristic feature of the apoptosis on the light microscope, and the answer is the condensation of the nucleus, a very characteristic feature of the apoptosis. Then the next question, location of the LDL inside the cell. So the LDL is located on the cytoplasm of the cell and it acts as a marker for the cytoplasm. So one liner can be asked that what is the marker of the cytoplasm, and the answer is the LDH, lactate dehydrogenase. Then moving on to the next question, secondary healing mechanism. It occurs by formation of a granulation tissue. Okay, so the next question, ion which is important in the cell injury. So the ion which plays an important role in the cell injury is the calcium ion. P53 regulates which phase of the cycle? It regulates the G1S phase of the cycle. The most common cause of cell injury. The answer is the hypoxia. And questions can also be asked the most common cause of the hypoxia, and it is the ischemia. Okay, then most sensitive cell to hypoxia. So the cells which are most sensitive to the hypoxia, these are the neurons. Okay, the first is the neuron, and the second most common cell which is sensitive to the hypoxia will be the cardiac myocytes. So the next question, most resistant to the cell injury. Okay, the cell which is most resistant to the cell injury, and the answer is the fibroblast. Myelin fibers are due to damaged cell membrane, and this myelin fibers, this is a sign of irreversible injury. Okay, so in irreversible injury we can see myelin fibers. Then the hallmark of acute inflammation, asked multiple times, very important question, the marker of the inflammation, and the answer is increase in the vascular permeability. So the next question, rolling of the neutrophils, it is done by the selectin, and whereas the adhesion of the neutrophils done by the integrins. So these are certain points related to the inflammation. Okay, so you need to remember the phases of the inflammation, the acute, the chronic, and their stages. Okay, then moving on, the C1 esterase deficiency. Whenever this enzyme is deficient, then we can see hereditary angioedema edema. Then the next question, the C5C9 complement deficiency. So whenever we see the C5C9 complement deficiency, the person will be suffering from the Neisseria meningitis, and it is a capsulated organism. So the risk of infection with the capsulated organism increases if there is C5C9 complement deficiency. Then moving on to the next question, the stellate granuloma. This granuloma is seen in cat scratch disease. So this question is also an important question because this is asked multiple times, the stellate granuloma. Likewise, you can see another granuloma, the non-caseating granuloma, and this is seen in sarcoidosis. So it is an autoimmune disorder and mostly females are affected in this. Okay, so the next, another granuloma, the caseating granuloma, and this is seen in the TB. Then joint and skin hyperextensibility and laxity, this is seen in Ehlers-Danlos syndrome. So it is in, so in this Ehlers-Danlos syndrome, there is connective tissue defect which leads to the hyperextensibility of the skin and the joints. Then the next question, perinuclear pigment in the cardiac muscle. It is the lipofuscin, and image based question is also asked on this lipofuscin. Then the next question, neural tube defect shows multifactorial pattern of inheritance. Then the next question, which subtype of breast cancer has the best prognosis? And the answer is the luminal type, luminal A type. Neurofibromatosis 1 has which pattern of inheritance? It is the autosomal dominant. So you need to know which conditions are autosomal dominant, recessive, X-linked recessive, and X-linked resistance, because one question from this pattern of inheritance is asked every year. Then the cells responsible for the chronic graft rejection, and it is the T cells. So T cells are responsible for the graft rejection, that is chronic graft rejection. And if it is hyperacute, then preformed antibodies are responsible for the hyperacute. Okay, then the popcorn calcification on chest X-ray, it is seen in the pulmonary hematoma. The next point, dystrophic calcification is seen in atherosclerosis. So there are two kinds of calcification, the malignant and the dystrophic. So malignant, it is mostly due to the tumors, and dystrophic, it is seen in the normal tissues but which are dead and degenerated. Okay, then ATP-B7 gene mutation, this kind of mutation is seen in the Wilson's disease. Wilson's disease also a very important topic. You need to know all the points related to it. Then the next question, myasthenia gravis is which type of hypersensitivity reaction? And it is a type 2 hypersensitivity reaction. So you need to know all the type of the hypersensitivity reactions. Type 1, which come under it, the examples of the type 1, the type 2, and its example 3 and 4. Okay, so one question from the hypersensitivity reaction is asked every year. Chronic inflammatory mediator, it is the interleukin 6. So this chemical mediator acts as a marker for the chronic inflammation. Then marker of the iron deficiency anemia, and it is the serum ferritin. And the marker of the iron deficiency anemia, it is a very important point. And other points related to this, the microcytic anemia, poikilocytosis. So these are certain other findings which you can find in the iron deficiency anemia. Okay, then a marker of the intestinal inflammation, it is the fecal lactoferrin. The immunoglobulin with the maximum concentration in the blood, and it is the IgG. Okay, and the immunoglobulin which is found in the secretions, that is the IgA. The orphan NEI is characteristic feature of the papillary thyroid carcinoma. Papillary thyroid carcinoma, also a very important topic. So image based question is asked on this orphan NEI, so you need to look at the image also. So another point related to the thyroid cancer, the marker of the medullary thyroid carcinoma, and the answer is the calcitonin, because this medullary thyroid, it arises from the parafollicular C cells. So these were certain important points related to the pathology which were asked earlier. So questions one liner, direct one liner also can be asked, and if one liner is asked, then it will be very easy. But if clinical question is also asked, then no worries, they'll be given somewhere in the question such points, like they'll describe a case with certain features, like the cough, the patient has presented with the cough, then hemoptysis, weight loss, and all, and the features will be suggestive of the TB. Okay, and they'll ask you which type of necrosis can be seen in the patient. So you need to make the diagnosis as TB and select the answer as the caseous necrosis. So this was just an example of how the clinical questions can be asked. So by looking at these points, so you will be able to solve clinical based questions also. So that's it in this video, guys. I hope you find this video useful. Like the video, subscribe to my channel, subscribe to GrowMed, and also share this video with your friends. All the best for your exam, guys. Thank you. Bye bye.